Welcome to part 10 of Neuro. We're going to talk about two conditions that affect a child due to cranial anomalies. The first is microcephaly, and how timely this is, considering that the new Zika virus is being spread worldwide. So what microcephaly is just a small head, and it's related to an impaired growth of the brain itself. It's associated with some type of a neurologic event that occurs in utero, and it can be hypoxic, or as we're seeing with this virus, it's directly affecting the brain itself. Now, when a child has microcephaly, the face itself doesn't look that small, but the rest of the head definitely does. The way we treat these children is to support their greatest developmental potential. So we need to follow them very closely in the Neuro clinic and in the well child clinics and see what they can and cannot do and see if any additional neurologic issues come up. The next anomaly is what we call craniosynostosis. Kind of a funny word, huh? What happens here is the child ends up having a small head because the suture lines close prematurely. So as a result, the child has a narrow face. The contour of it is relatively flat, and as you palpate the head, you may feel ridges where these bones have grown over. And what we do with these is we treat it surgically. Neurosurgery is involved as well as plastic surgery. This is a very busy slide, but it does show you the different forms of craniosynostosis. Those of you who are at chalk may be taking care of children who have some of these anomalies. What do we do for this? Well, they can put the kid in a helmet, and they're going to mold this child's helmet directly to her as they make it, and there it is. But eventually this child needs to have a surgical correction, and what they do is they open the scalp, and then they also open the bones. This shows the marks on the head, and you see that elongated head. And this is what it looks like after surgery. So preoperatively, this head is in the shape of an almond, but post-op, we can see how everything has been broadened, and now it looks more like the normal shape. And the rest of these slides are all pictures of these children, but look at the miraculous changes that occur in this baby's head. And so when you're taking care of these children and you're interacting with the parents, you want to give them reassurance that what they're about to have their child undergo is going to be beneficial. And the pre-op and post-op pictures speak to them so that they know that this is the right thing to do. And here's another little guy. A super long head, now he has a nice round head. And look at this little one. She had severe problems, but as she grows, she has a beautiful, not quite round head, but more of a square head. And you can see it in this little child where she has the normal facial features, but as you look back towards the back of the head, it's a lot narrower. And after 3 years, who would know that she even had a problem? And here's the last picture. The care of these children, in addition to talking to the parents and providing psychosocial support and psychological support, is just your routine post-op care. And this ends the lecture on cranial anomalies.